Namaste everyone. Welcome to our exclusive Facebook Live session. Today, we are going to be discussing a very important topic, advances in minimally invasive cardiac surgery. I'm very happy and honored to have with us Dr. M Yusuf, Senior Consultant, Cardiothoracic Surgeon, Apollo Hospitals, Greams Road, Chennai, who also specializes in robotic and MICS, which is minimally invasive cardiac surgery. With his wealth of knowledge, Dr. Yusuf will guide us through the essential aspects of MICS and robotic cardiac surgery, sharing his expertise and answering all your questions. A very warm welcome to you, Doctor.
Thank you. Good afternoon, everyone.
So let's start with a basic question, Doctor. What is minimally invasive cardiac surgery?
The term minimally invasive cardiac surgery was initially coined or defined to avoid anything that prevents the full cut of the central chest bone, the sternum. So, even partial cuts were initially defined as minimally invasive cardiac surgery. But since then, over now 2 decades, we have moved on further to become much smaller, in fact, surgery with just holes rather than even cuts. So, current definition I would say is completely avoiding the cut in the bone and making as small cuts as possible with assistance of either video assisted camera or robotic assistance.
Which we'll be discussing in detail this session. Doctor, to start with, we are the first to perform robotic cardiac surgeries in India. So, what makes minimally invasive cardiac surgery different from traditional open heart surgeries?
Yes. So, the minimal invasive cardiac surgery, as I said earlier, is to avoid the big scar in the sternum. So, the biggest scare of any patient undergoing cardiac surgery is the fear of cutting through bone, opening the chest, and suffering with pain for few months thereafter. So, the minimal invasive cardiac surgery avoids this completely. And now, as you rightly said, the robotic assisted cardiac surgery, which we are the pioneers, and we started it 5 years ago in the country. And now we have been training more surgeons across and across the group as well. So that even makes it much more convenient to the patient and to the surgeon with the aid of technology, better visualization and better handling.
So, what are the conditions that can be treated with robotic MICS, Doctor?
Now we can confidently say almost all adult cardiac procedures, first time cardiac procedures, can be done with robotic assisted or minimal invasive cardiac surgery. So, about in my practice, it's almost like 80% of patients we don't open the chest. But there are still a role for some complex procedures like major aortic surgeries, which includes aortic dissection or tear repairs, redo surgeries, and transplant surgeries. There, open surgery still has a big role to play.
So, are there any specific criteria or patient profiles that needs to ensure that they are the ideal candidate for a robotic MICS?
Yes, I mean this I would have appreciated this question few years ago, because then we were picky about patients. So we had to choose the right patient and give them the treatment. Now that we have come off the learning curve and we've been doing it routinely, we are able to provide it for almost all patients. Nothing is 100% in medicine, but most patients can have robotic or minimal invasive cardiac surgery now. In fact, the older age group patients benefit better. So, the patients with more comorbidities and sicker patients benefit better with robotic cardiac surgery or minimal invasive cardiac surgery, which is minimal invasive cardiac surgery, as I already mentioned, is a term given to less invasion. And robotic cardiac surgery is the assistance provided to make it even more simpler and better, precision and better visualization.
So, when you say minimally invasive, what are the benefits of performing a robotic MICS on a patient?
Yes. So the initial benefits when we started doing them couple of decades ago was only getting the patients out of the hospital soon, which usually is about 3 to 4 days. If it's a single bypass block, 48 hours, and getting to full normal activity within 2 to 3 weeks, as opposed to 3 to 6 months with open surgeries. But now, with more and more surgeons performing more procedures and routine procedures, There is also a huge benefit in reduction of mortality, which is the death rate and complications rate. They have come down significantly. So the recent evidence in literature states for high risk patients where we have a scoring system called Euroscore. If they have a higher Euroscore, which is even more than 5, then they benefit more by having minimal invasive procedures than open procedures. So that's where we stand now. So benefits are not only in quicker recovery, but in reducing complications and mortality as well.
Speaking about the benefits, doctor, how is the post-operative care? Is this also a change with when compared to the traditional methods?
Yes, there is a significant change. Most of these patients can be taken off the ventilator pretty much quickly. Within 2 to 6 hours, they are off the ventilator, and day 1 they are walking. So that's what we practice now regularly, and day 2 to day 3 they go home. This is the current practice. Some elderly with more problems, we keep them a little longer, so maybe for 3 or 4 days. So coming to that, I can quote a patient where the oldest patient we operated was a 93-year-old, and he is actually the oldest patient who underwent cardiac surgery in the country. If not for robotic assist cardiac surgery, he would not have had surgery, and there was no other option available for him because stenting was very calcified vessels, considered very high risk, and he was having ongoing pain. Now it's more than 3 years, he's still very active. He was an active person and he still continues to be active. So these are the benefits.
So you're saying without the advent of robotic MICS, he wouldn't have even qualified for the surgery?
No, there was, because he was too higher risk for open surgery.
Okay. So while we talk about risks, what are the potential risks or complications associated with robotic MICS?
Yes, as I have been mentioning earlier, compared to open surgery now, the actual risks and complications are less with robotic or minimal invasive surgery. The biggest factor adding to reducing the complication is the yearly mobilization, because the problem with cardiac surgery is when we cut the bone, they have pain. So patients don't take deep breaths. That leads to lung problems, and they have big cut in the legs for taking veins for bypass surgery. So they are very hesitant to walk. So these two problems put them into other complications like lung infection commonly, whereas with robotic minimal invasive we completely avoid that. The complication that may be related to some patients with robotic or cardiac surgery is conversion to open surgery, because if there is a complication or emergency situation during any of these minimal invasive procedures, then we may have to convert them to open cardiac surgery. That is one complication which we may face, and the risk of that is less than 2% across the globe, which is also less in our unit as well.
Doctor, you mentioned about minimizing scarring.
Yes.
How does MICS minimize scarring and reduce the risk of infections as well? Does it actually reduce the risk of infection?
Yes, because the sternotomy involves the bone, cut in the bone. So in some older people, or when we take arteries from both sides of the chest, which is beneficial for young patients, there is a higher risk of infection to the wound and the bone. And usually the lower part of the bone keeps moving more. So there is a 3 to 5% infection risk even in this day and age with open surgeries. Whereas with minimal invasive and even more so with robotic surgeries, the risk of infection is almost 0%. So over the last 5 years with close to 500 patients, we have hardly seen any infection in the group. So this is not just us, across the globe, because there is no bone cut, it's just the skin cut which heals very quickly.
So you mentioned about quicker post-operative recovery, doctor. How soon can one get back to normal life, as in going back to work or daily chores?
Yes, so that's the biggest advantage. So hospital stays, as I said, 3 to 4 days. When they go home, we tell them they can do everything themselves independently, but we always advise them not to go out. In our country with the infection risks, about 10 days to stay indoors. During that time, we suggest somebody to be around in case of emergencies, which is rare, but it can happen. So for that reason, but they can do everything themselves from the day they are discharged. And once they, usually we see them in outpatients in 10 to 14 days time to make sure the wounds have healed and they're back to normal. Once you have done the checks, they are back to work. So they can go back in even complete manual work within 3 weeks. I have had a very young patient, 32-year-old, who went back to the gym in 3 weeks. So that's how good it is with robotic surgeries. With minimal invasive surgeries as well, maybe a week later.
So, doctor, that said, are there any specific lifestyle changes or precautions that patients are advised after robotic minimally invasive cardiac surgeries?
No, not specific to minimal invasive or robotic. In fact, we tell them you can get up and about quickly and get back to normal quickly. But like any cardiac surgery, especially bypass graft surgery, we advise secondary prevention, because there is two concepts in coronary artery disease surgery or management of patients with heart attacks or angina, which is ischemic heart disease as we term medically, the blockages in the arteries supplying blood to the heart. All these patients, we talk about two terms: primary prevention, secondary prevention. Primary prevention is avoiding having any disease in the vessels itself, that is before coming in to the hospital or seeing a cardiologist. But the term that we reinforce in patients who have been operated or intervened is secondary prevention, where the risk factors like diabetes, blood pressure, cholesterol, and smoking has to be completely taken care of. Smoking is within our hands, so patients should stop. If they smoke again, there is very high chance disease will progress and they will have problems again. Family history is not within our control. These are the 5 risk factors. But diabetes, blood pressure control, cholesterol control is very important. For this, we tell them lifestyle changes, which is 3 things: tablets, they have to take tablets for life to prevent the problem coming back or worsening any mild disease in the vessels. Secondly, regular exercise, which is sensible walking or jogging as per their physical activity, and sensible eating. They don't need to be on diet, but we give them advice on what are the sensible food they can eat. Usually low cholesterol, low fat. In some patients, maybe low salt. So these are the lifestyle changes patients have to make, which is not difficult at all. They'll be able to lead a normal life with these lifestyle changes for much longer.
So, have there been any recent breakthroughs or advancements in minimally invasive cardiac surgeries that could notably improve the outcomes in complex cardiac cases, doctor?
Yes, there have been a lot of breakthroughs. Most of them in cardiac surgery are around. Since we are talking about minimal invasive cardiac surgery, I'm not going into other major aortic or transplant surgeries. But in minimal invasive cardiac surgery itself, as the specialty, which is a super specialized specialty, there has been a big breakthrough with the addition of robotic assisted surgery. So we have able to perform more better valve repair procedures like mitral valve repairs with better outcomes, and we have also started performing aortic valve procedures robotic assisted, which is also, we are one of the few centers across the globe doing it. And the major breakthrough in the bread and butter stuff of our country, which is coronary artery bypass graft surgery, is total arterial revascularization robotic assisted cardiac surgery. The term may look complex, but
Complex.
to explain it in simplified manner, so generally cardiac surgery is for patients who have multiple blocks. So for patients who have minimal block, there are 3 options for patients who have blocks in the blood vessels supplying the heart. One, if it's less, we can manage medically with medications. If it is 1 or 2 blocks in certain points, then stents are better. If there are multiple blocks in all the 3 major vessels, especially in diabetics or patients with reduced heart function, surgery is the best available option. In that group, avoiding the cut in the sternum and avoiding any cut in the legs reduces trauma significantly and enhances recovery with much less complications. which is what we are able to provide with robotic assisted. So the major advantage of surgery over stenting is use of the artery from the chest wall. There are two arteries on two sides of the chest, one on the left, one on the right. As I already mentioned earlier, when we do the cut in the bone, if we take both arteries, there is a high risk of infection to the bone because the blood supply to the bone is affected. Whereas with robotic surgery, we are not cutting the bone. So we are able to use both arteries. And since the view is much better, the vision is better and precision is higher, we are able to get longer length of the arteries as well. So with these arteries, we are able to perform all the blocks, 3, 4, 5 even, blocks without any other cuts in any other parts of the body. So this total arterial revascularization, which as we say, using both arteries, gives the best long-term outcome. As I said, the major benefit of surgery is using this artery, not the vein in the leg. So that artery, when we use both and bypass all the blocks with these arteries, more than 90% patients do not have problem for the rest of their lives. So that is the biggest advantage or breakthrough that we are able to provide in our country. And we are one of the biggest numbers in the world providing these procedures.
So, how do we decide on who undergoes a total arterial revascularization, doctor?
Yes. So now in our unit, since we have been doing so many over the years, we offer it to everybody that comes to us with this problem.
Irrespective of age
Irrespective
or
of age,
comorbid conditions.
comorbid, yes.
Okay. So, doctor, we'll take some questions from our viewers. My father is quite anxious about undergoing heart surgery. Could you please explain how robotic MICS could offer him a less daunting approach?
Yes. So as we already discussed, the major scare for anyone about cardiac surgery or heart surgery is the big cut in the chest and the suffering related to that for over months. And they also see patients with long cuts in the legs. Here, we can easily tell them we don't cut the chest or the legs. They go home with just tiny holes and maybe a 5 centimeter skin cut. With that, when we put that forth, most patients accept to have surgery because that daunting fear is taken off. I have had patients who ask me, did you really do the surgery after a week? Because they don't feel the pain which they have in mind seeing other patients in the last over the years.
Hello, doctor. My grandmother has multiple health issues. So, what are the preoperative assessments that are crucial to determine if she is an ideal candidate for MICS?
Yes. So that's a good question because these are the patients, as I mentioned earlier, would benefit more, but we have to carefully assess them. So, in fact, patients in the elderly age group, mainly the octogenarians, more than 80s, is about 25% of the patients that we operate now, more with minimal invasive and robotic. In those patients, the first thing we assess is their suitability and whether they need the surgery. First, we check whether there are any other measures where surgery is surgery, even if it's minimally invasive. So, best thing would be to avoid surgery at all if possible. If it comes to that last option where surgery is necessary, yes, then we offer it. We have to assess them carefully, which we do with our team. So, all this minimal invasive and robotic procedures, I have to also mention it is important to have a good team and infrastructure. Plays a equally important role as the surgeon. Surgeon leads the team, but it's the whole team and the infrastructure which we are able to provide in big centers like ours, Apollo Greams Road. So this is equally important. That is one thing, and the other scenario is to avoid those emergencies. Carefully choose the patients. Now that we are doing more and more, we are not choosy about patients, but we would have to carefully prepare the patients to have less of emergency problems or complications and recover quickly. So as a team, we evaluate the patients and do the needful to prepare them to have a less daunting course and much quicker recovery after surgery.
So, what would be your message to our viewers today, doctor?
Yes. So my message would be, as I already said, take care of your health. Primary prevention is very important in patients or people who have history of ischemic heart disease in the family or diabetes, long term diabetes. Please have regular health checks once a year or at least once in 2 years and treat the problems before they arise. Secondly, if you do have a problem, if like cardiac problems, whether it be valve or coronary artery disease, please don't be scared of intervention and keep away, because not everything ends up with a big cut in the chest and pain and suffering for months. Now that is least involved. Most patients don't need them. A lot of them can be stented with smaller intervention like stents or robotic assist cardiac surgery. So don't shy away from interventions, have the necessary treatment and lead a normal life. Even after that, secondary prevention is important, as we discussed. So continue to see the doctors. Doctors are not scary and surgeries are less scary these days. So it is wise to seek medical help and take appropriate measures accordingly.
Thank you very much, Doctor, for guiding us through various advancements in the field of robotic and minimally invasive cardiac surgeries as well. For appointments with our expert on robotic and minimally invasive cardiac surgery, Dr. M Yusuf, Senior Consultant Cardiothoracic Surgeon at Apollo Hospitals, Greams Road, please contact 044 4040 1066. I repeat, 4040 1066. Thank you very much, Doctor. Thank
Thank
you,
you, everyone.
viewers.